I got to check my shoulder, you see,
Mm-hmm.
and I got to make an accident like 3 years ago,
Mm-hmm.
and I go to the hospital. The doctor told me it's smash. I don't know how to say exactly in English. These bones right here,
Collarbone.
collarbone,
Or clavicle. Mm-hmm.
clavicle, something. It's told me it's broken,
Mm-hmm.
but I'm not sure it is broken because I get moved my arm.
Mm-hmm.
So the accident made like 3 years ago.
Okay. So to clarify to the viewers, okay, so he fractured his collarbone over here, and what makes it worse?
What do you mean?
Well, you mentioned on the consultation that sleeping and working makes it worse, right?
Yes, sleeping, walking.
And what else? Walking as well,
Walking
right?
too.
Yeah. Okay. So we're gonna take a closer look, see what's going on. Okay.
Okay.
Okay. So as you can see, okay, with your collarbones, this is your left one, and this is your right one.
Okay.
You see how much higher this one over here versus over here,
Yes.
lower, right? So we can tell there's something going on over here. This is not properly connected to this one. Okay. So there's a slight little misalignment at your AC joint. Okay.
Okay.
Now you also mentioned every time you walk, pain. Why? Well, when I take a look at your pelvic foundation itself, you see how wide this one is over here? See how narrow this is over here? Right? Big,
Small.
small, right? Why is that? Well, when I look over here, okay, this is a gluteal full shadow. It's supposed to be in the center. Just like what you see over here, this is center. Do you see where this line is? It's way to the right. So, simply put, okay, your hip went all the way this way. Okay, so since your hip went all the way towards this way,
Okay.
okay, that's why your body had to compensate.
Oh.
Because we cannot just walk this way. Correct? So how do we get from here, head over here? So somewhere around the middle of your chest, have to go this.
Okay.
That's where you see the twist over here.
Okay.
Right? So every time you walk, because there's so much tension going like this way, walk, this one has no choice but to go this way. Okay, more forward.
Okay.
So that's why aches and pains. Even right now, we can see in the viewers, just relax your hands. Turn this way, turn this way. Okay. Even we can see right now, see, when you're in relation to, this side is much more forward than this side, right? All because the way you're all twisted up. Okay. So to help take a lot of the pressure off of this joint, actually starts from way down here. So we're gonna untwist you from here, like this, and alleviate a lot more.
Okay.
Okay, that's a strategy for you. You really twisted up there, my friend. Tender? Pain?
Yeah, that's not.
Huh?
Nothing.
No pain. What over here?
No.
No pain. Because what I see right now, there's a lot of swelling right over here. Okay, quite a bit of swelling right at that location. Okay. Right there. Look at that. This isn't moving whatsoever. Okay, that's stuck. Yeah, this hip is not happy. It's just not moving. Okay, that right hip. Feel the difference here?
Yeah.
I can move your left
Yeah.
side. This right side is just not moving. Okay, that's a brick wall. Right there. Oh. Coming up. Okay, walk around.
Wow.
Yeah, keep walking.
That's different.
What's different?
That's different. My legs
Mm-hmm.
is it's just like almost the same side. You walk before a little like almost like this. One more little bit. Now it's in my back. It's I don't know. It's something different.
Okay. So just want to clarify. So you were saying it before it felt like it was.
I think I'm sure this like a little different now. Before a little like I'm thinking I use it almost more this. I use this on my legs almost. This is not some, you know.
Good. I want you to walk a little more. Let me know how this is feeling.
Better.
Better, right?
Yeah.
How do you like that? You didn't even touch your shoulder yet. Huh?
Oh.
How much would you say is better?
Like 16%, I think.
Just from that alone, right? Ain't that something? No, that's why it's so important to make sure your pelvic foundation is level. It was out for a very long time. I want to get this straight. So the medical doctor suggested to what? To break this bone and fix it?
Yes.
Wow. That's something. Okay. So let's take a look, see what your shoulder's doing. So right now what we're checking is, okay, the clavicle to the sternum. Okay, it's motioning fine. Okay, we're checking the AC joint. No, just relax, just relax. Okay, yeah. Slightly out. Okay, so it went superior bent. Okay, no, just relax. You should check your shoulder blade itself. Okay, the scapula. Okay, that's also out too. So I'm gonna take a look. Check your glenohumeral joint. Slightly misaligned. Slightly. Okay, so first things first, what we're gonna do is we're gonna set the scapula over here. Okay, it's gonna take some more tension off of this clavicle. So as we're motioning this, okay, we're moving it superior, lateral, medial. Okay, that's fine. And now we check it by going inferiorwards. See, on the lateral side moves fine. On the medial side, it's a brick wall. Do you feel that? Doesn't move. Okay. So this fell over here. What it did was it went superior. Okay, and it also got stuck medially wise. So we need to fix this one over here. Alright. Don't worry about it. Pump this up. We're gonna set it as gently as possible. Right? That was it. See that? You feel that difference now? It's moving.
Yeah.
Right? Okay, so close in. How's it now?
Wow.
What's different?
It's not pain like too much like before. Before like I had like pain like almost like all day like something like pain not so hard but like medium.
Okay, so how's it now?
Now it's a little less.
Good. Now we're gonna check it again. And an AC is still stuck. Better, but it's still stuck. See, it's just not going down at all. See, I can move it upwards, but see, going downwards, no, it's just not a happy camper. Okay, just relax, just relax. Just gonna get it ready before we set it, okay?
All right.
Just let it go, just let it go, right there. There we go, a little more. Okay, relax, relax, relax. See, now it moves quite well. Yeah, glenohumeral joint's out too. Okay, relax, relax. Just relax. Okay, take a little more. There we go. Walk around.
That's good.
Move around.
That's wow.
Keep moving.
Now it's not pain so much in my back. Behold, it all the time pain my back.
I know, but so how's that left shoulder now? What's different?
It's more like more faster.
Good.
Before like stuck, not so much for more faster like this. Now it's I can move more faster.
Good. We certainly did a lot to that shoulder today. We had to basically rebuild that shoulder of yours. Okay.
Thanks.
Oh, you're very welcome.
2 years ago, it's pain a little less, but this year it's a little more cold. It's pain too much, so that's why I'm coming here. But you gotta fix it a little bit. But that's what I say. Thank you very much. I'm really
you're very
appreciative
welcome.
for that. Thank you.
All right, we're all set.